So, hello and a warm welcome to everybody. I'm tuning into this brief video today. I'm delighted to be joined today by Garry Coles. Garry Coles is going to be presenting at the UK Hypnosis Convention in November this year, as you will have seen. But he's also offering a full one-day pre-convention workshop on the topic of Hypno-Oncology. And we're thrilled that he is. Garry, welcome first of all.
Thank you very much.
What can we expect from this workshop? Tell us a little bit about it.
It's very, very intensive because sometimes I do one day, sometimes I do 2 days. So it depends whether lots of people want to practice. This one, there isn't time to practice. There's lots of demonstrations from me. So you're
Great.
going to see lots of wonderful techniques, lots of very powerful techniques. We're going to give you a lot of background, teach you, so you're going to have the confidence to work with cancer patients all through their journey. You're going to learn a lot of background. You're going to learn a lot about approaches, ethics, techniques, communication skills, absolutely everything that you need, but down into one intensive day. And the other thing that's good on it is because it's a very emotive subject and a lot of people panic about it. Once you've done the day with me, you're not on your own. You do get ongoing support. We've got about 250 pages of material, scripts, and so on that are
Great.
provided on the day. And also we have a private Facebook group. And what we have in the private Facebook group, I have further mini lectures, audios, and so on going forward. If I find new research, that goes up there. If I write new scripts, that goes up there. And we also have mentoring sessions. If anybody has any questions, queries, or they're struggling with a case, they don't have to pay for mentoring. They just ask in the Facebook group, and they're still supported going forward.
Oh wow, that's great. That's great. Whenever people speak to me about working with cancer patients, I'm always stating that they need to treat it with caution and to have the utmost ethics in the way in which they're approaching it with regards to what they can claim to do. And I think that a lot of people I'm listening to this can perhaps be reassured by the fact that not only are you contracted to a major NHS hospital for oncology based hypnotherapy, that you train doctors and psychologists and hypnotherapists around the world on this subject, and they could be reassured of that, can't they?
Absolutely. I mean, if they follow the link that you can see in the background, that tells a lot about the course. It tells you all the what's on the course, what you can expect from it, what the contents is. But you'll also see lots and lots of testimonials, some written, some video that have been done by doctors, people that I've done demonstrations with, and so on. And yeah, I teach doctors regularly. I did a course in Belgium where over 50% were doctors. I was asked to do a private one in Bahrain where they were all psychologists. But generally, they are a good mix of doctors, nurses, hypnotherapists, psychotherapists, psychologists, and so on. And the doctors are actually really coming on board with it. I mean, I've had a few of them say that, yes, my approach is very ethical. It's actually spot on with knowledge. Um, and one of the good stories we had was my background. Yes, I've spent 17 years working in an oncology unit in an NHS hospital. I was in the first cohort in the UK to be awarded a master's degree in clinical hypnosis, and it was a research master's. And my piece of research, which actually I do in a different talk, which I've done at the conference previously, was I
Yeah.
did a study into pre-surgical hypnosis on the effects that had on recovery quality in breast cancer operations, and
Yeah.
I was
Wow.
able to demonstrate that it did and how and why. To the extent that when I was going through it was quite interesting. I had lots of ethics problems initially. The university were a little bit frightened because it was the first time they'd worked with cancer patients.
Yeah.
The hospital were a little bit nervous, but we got it through all the ethics things eventually. And then my final hurdle was the teaching surgeon, and they said, right, you've got to meet this teaching surgeon. It's her decision whether it goes ahead or not. And so I said, okay, I'll do that. And it was a brief meeting, but she was asking me lots of incredibly difficult questions, and I thought she just doesn't want to do this. She's just trying to catch me out so that she can say no. But looking back on it, I realised that she was testing how genuine I was and how robust my research was, because she said, yes, we'll do this. So we started doing it, and what I thought was a real turnaround time was several months into the project. She came to me one Friday morning because that was the operation day for breast cancers. She came to me and she said, now we've got an idea of the patients that work best with you and the ones that you're after. So she said, now we know that. She said, if you would ever like me to change my elective list around to accommodate you, just let me know. And I thought, if I'm getting a teaching surgeon now moving around their elective list to accommodate me, they must be pretty happy with the results that they're seeing with their
Yeah,
patients.
right, right. And you know, there's a great need, isn't there, for this kind of work. There's big numbers still. It's you know, a prolific disease, sadly,
Yeah.
in its various different guises. There's a lot
Yeah.
of need, and you know, what a wonderful thing to be able to help
Yeah, I
with.
mean, statistically, it's interesting because lots of people go after sort of anxiety, depression, and all this sort of stuff, but a lot of people don't realise that in the Western world, actually, people born since 1960, 1 in 2 will experience cancer throughout their life.
Yeah, wow.
1 in 5 women get breast cancer, 1 in 7 guys get prostate cancer. It's a huge amount of statistics.
Yeah,
But what's also interesting on that is that Sage did some research and found that 40% of people going through the cancer journey seek out complementary therapies. So you could
mm,
argue that 20% of the population are looking for your skills
yeah,
to assist them through the journey. And at the moment, it's almost as though cancer is the new pandemic because we've had COVID. And the problem with COVID is it put the diagnosis and operations and treatments backwards by about a year.
yeah,
Now that has a huge knock-on effect. I mean, if you miss a diagnosis for a year or you miss a year starting treatment, that makes the prognosis far, far worse going forward, which then causes a huge psychological issue with the people going through the journey, as well as potentially stronger treatments, more side effects, and so on.
yeah.
So we're needed far more greater now than at ever time before.
Yeah, yeah, yeah. Well, hopefully this is an opportunity that lots of people will take up and seize. You know, I'll very much look forward to seeing you again in November, Gary. So for those of you, just as a reminder, that is a Thursday, the 10th of November, a full day workshop with Garry Coles, Hypno-Oncology. Gary, thanks very much for joining me today.
Thank you very much, and I look forward to seeing people studying with me in this vital area.
Yeah,
Thank you
great.
very much.